Well, summertime is right around the corner, and for a second spring, COVID units are filling up, workers are staying at home, and parents are navigating school and sporting events. And we know you have a lot of questions, and that's why we're putting you, the viewer, in the driver's seat this morning. We're joined now live by Dr. Phillip Levy, Chief Innovation Officer at Wayne Health. Dr. Levy, thank you so much for joining us this morning.
My pleasure to be here with you.
Our first question comes for Jennifer. Jennifer wants to know, how soon after having COVID-19 should you wait before you get the vaccine?
So this is a common question that we're getting these days. And the single best answer is as soon as you're not symptomatic anymore. There are some discussions and rumors that people are saying to wait a full 90 days before you recover from a COVID infection, and you don't have to wait that long. As soon as you're asymptomatic, no longer fever, no longer cough, no longer shortness of breath, it's okay to go ahead and get the coronavirus vaccine.
Well, let me follow up with that. We hear about these COVID long haulers. So are you talking about like the acute symptoms, or what should long haulers do? If you still have that shortness of breath months afterwards, should you get the vaccine?
So that's another great question. The reality is that when we're talking symptoms, we are talking acute symptoms. So what we're trying to do is avoid two things. Number one, people who are still spreading the virus from going to a vaccination site and potentially infecting others. The second thing is that every time you get an injection of a vaccine, the intended purpose of that is to trigger your immune system to get a response. If you've already had the coronavirus and you're experiencing long haul or prolonged symptoms, while this is not a group that's been studied, there is the possibility that the vaccine can make your response to the virus a little bit more aggressive, a little bit more intensive. And so for long haulers, I think the best bet is to work with your doctor to figure out when you're really in the safe zone to consider getting vaccinated.
All right. Well, our next question comes from Legina, who asks on Facebook, if you got the shot and you're around someone who tests positive, should you be tested for the virus?
Absolutely not. So that's one of the things that the CDC has strongly recommended, is that people who are fully vaccinated, and fully vaccinated means they're at least 2 weeks after their second dose of Moderna or Pfizer, or 2 weeks after the single dose of J&J vaccine. And the reason not to get tested if you're fully vaccinated is that while we do think there may be a very brief asymptomatic carrier period, and that's still not known for certain, it's probably not going to be more than a day or two. And testing for this, you might miss a window for this, but also it's not going to change anything because the virus is not going to be spread, or at least as we think, amongst people who are vaccinated. Theoretical still, but recommending against getting routine testing.
All right, and Dr. Levy, there's a lot of confusion and certainly a lot of concern about the vaccine and pregnant women. Now, on our Facebook page, Aaron asks, why is this vaccine being suggested to pregnant women? I thought it was unethical to include pregnant women in studies because of the obvious risks.
So the first thing to answer that question is we're beyond the study phase. Any vaccine that is currently being used clinically under emergency use authorization has been authorized by the FDA for human use. So it's not research at this point anymore. But if we think back to the first SARS pandemic, or the first wave of SARS back in 2004 and 3, one of the biggest complications that occurred with SARS was miscarriage. And so the thing with pregnancy is that you're not just dealing with one person, you're dealing with two people. And the thought is that if you can get the mom vaccinated, there may be cross-transmission of that protection to the fetus. And we're actually seeing some evidence of that. And this is actually great timing for this question. Just 2 days ago, the New England Journal of Medicine published a large registry study on the safety of coronavirus vaccines, both Moderna and Pfizer, in pregnant women. Seems to be safe. No difference in outcomes compared to historical trends. One sort of caveat with this is all the data come from later trimester patients. So still early on, we don't know, but it seems to be safe in later trimester patients for sure.
Dr. Phillip Levy, Chief Innovation Officer at Wayne Health, thank you so much for your time and insight this morning.
My pleasure.